Agility Health was formed in 1968 by a clinician named Gary Nadervelt, and we provide physical rehabilitation, occupational therapy, athletic training, and speech pathology, and principally in the United States. Initially, the question was, what do we want to be a public company? And the answer for that was yes, because we really wanted to find a vehicle to reward our employees, both through incentive stock purchase plans or as well as stock options. Then we looked north because, in the States, it's pretty cost prohibitive to go public as a company our size. And also, we would be a meaningful healthcare size organization in Canada as one of the larger healthcare issuers on the TSX. The physical rehabilitation market is very fragmented. Only 10% of the market really is consolidated, and so we're really looking to consolidate the remaining piece. As a provider of therapy services, we're looking to acquire outpatient clinics and partner with hospital institutions. Of size, we are better able to manage the cost as well as improve clinical outcomes, which in the end will decrease costs to the healthcare system overall. Our number one asset is our culture. We have a very strong clinical culture. I'm a physical therapist by background, and many of our management team has a clinical background as well. And so as clinicians, we have a very strong relationship skill set, and that really has boded well for us as we grow organically in terms of nurturing relationships with hospitals and other institutions, as well as networking within our industry. I think one of our core strategies is really the idea of partnering and really take that seriously. And I think that's really a skill set in and of itself. We look to partner with individual clinicians who really want to maybe start a new de novo clinic. Maybe it's doing an acquisition where we're buying a super majority of somebody's clinical practice, but retaining their ongoing involvement in a minority position. Whether it's forming a joint venture with a hospital or another type of institution, going forward in a more collaborative fashion. And I think that's really a core asset for us, or core skill set for us. In terms of maybe strategy, I think we have had a strategy of creating a diversity or of a portfolio of services, and so many in our industry really stick to one line of work, like just outpatient services or just senior care. We really have provided the full continuum of services, which really makes us a bit unique. And also geographically, we really wanted to diversify where we were located. And so in the States, many things are still very regional in terms of reimbursement, and really being able to diversify geographically allows us to have an even lower risk profile than even a low-risk healthcare company does in general. Yeah, our goal is to be a top 5 rehabilitation company in the States. We think we can grow easily at 20% a year, considering the fragmentation in the marketplace and the skill sets that we provide in the back office functions that we've developed to provide the fuel for growth going forward. We are in a fairly heavily regulated industry in the healthcare business, and so we were very accustomed to new regulatory changes of being public. We're also used to, many of us have been on boards and have a lot of board experience. For us, being public has been a relatively easy process and hasn't been that traumatic. I think, though, giving suggestions for somebody going forward is really make sure you hook up with good advisors. And we've been very thankful in that we've met up with Wildeboer DeLeese, as well as Bloom Burton, who's a boutique healthcare investment bank in Canada here. And then also just kind of be pragmatic. This has been a 4-year journey for us. It started through the CPC process and went public in October. And actually, just taking your time and looking for the right market conditions and learn the process has been very beneficial for us.